This is an introduction to the Self-Help Safe at Home program. This program uses Medicaid funding to provide supportive services to assist individuals with disabilities and seniors towards successful inclusion into the community. Waiver participants may come from a nursing facility or choose to participate in the program to prevent going into a facility. Here at Self-Help, the program is known as Safe at Home. Personal care aides and home health aides under these services are called home and community support services. Your self-help nurse and coordinator are still your supervisors, but we work very closely with the service coordinators to provide these services. Under this program, the service coordinator is also known as a social worker. Sometimes the patient or the client is known as the participant. The philosophy behind the program is that the client or the participant is the main decision maker. They have the right to fail if they want to. This person-centered plan leads to empowerment, independence, as well as meaningful activities. Challenges that they may have is cognitive thinking, affective with feelings, or even behavioral with acting out.
Client must need oversight and or supervision. They can also need personal care and oversight or supervision. The program is really about teamwork. You, as the provider of care, work very closely with the service coordinator and the nursing supervisor, as we discussed before. And so in order for you to communicate all of this, we use a communication book. You may be communicating with a different shift, be communicating with the service coordinator, but communication is the key. There are team meetings that put you in touch with the participant, the service coordinator, and other people that are providing care. And the service plan and the care plan are the key to how you know what to do for that participant in the home. So the participant has a detailed plan that's similar to what we would call a care plan. But what's different is, first, it highlights the goals, what the participant wants to accomplish. And then the milestones, which is how the participant takes steps to get and reach those goals. The next is the intervention, what you as a caregiver does. And the last is the time frame. How long will it take you and the participant to go through these milestones to reach your goals? So what's the difference between tasks and goals? We, in the home care world, know about tasks, but in the nursing home transition and diversion waiver program, called Safe at Home, the focus is on goals. So example of a task is feeding a patient. In your care plan, it'll say, feed the patient twice a day or whatever meal you happen to be there for. But in the Safe at Home program, a goal would be for the participant to make their own breakfast. It is very important to follow the service plan and the care plan. So let's talk about milestones, how we would reach this goal for this particular participant. So you remember the goal was for the participant to make their own breakfast. So the first milestone would be for the participant to name 5 foods that they would like to eat for breakfast. The second milestone would be for you to talk with the participant about 3 foods that he might like to learn how to prepare. The next milestone is for you to make one of these breakfasts with the participant watching. And then the next milestone is to supervise while the participant makes one of these foods, and then expand it to the other breakfast foods that the participant was interested in.
The timeline. The timeline is established with the participant, service coordinator, RN supervisor, and you. You can use their goals to motivate the client. Not all participants can achieve their goals. This is discussed at the team meeting. So for instance, sometimes the goals can be used to motivate the client. If you find that the timeline is 6 months and you have about 2 months left, you can always use the goals to encourage a client. Your goals are almost up, maybe we can do this to help you move it along. But keep in mind, not every client or participant will achieve their goals, and that's okay. Your schedule. Many of these cases are 12 hours a day. For example, 8 a.m. to 8 p.m. and 12 hours overnight, 8 p.m. to 8 a.m. Safe at home versus traditional self-help cases. So in order to stay with the Safe at Home contract, you must work at least 1 weekend day. So you have to either do either the Sunday or the Saturday. If you're not available for weekend days, that's okay. You can still work with Selfhelp. You just will not qualify for this particular program. There's a difference in the paperwork as well. We want you to continue to clock in and out as you normally do, but please use the Safe at Home charting, and the nurse will discuss this charting with you.